Hi, I'm Dr. Mark Poole. In this video, I'll be discussing cardiogenic shock. What is it? How is it treated? And most importantly, how can you avoid cardiogenic shock? I know you care about your heart, so be sure to subscribe to my channel so you don't miss out on how to have a healthy heart. What is cardiogenic shock? Well, shock is not like in the movies where a person's in a car wreck and somebody says, "Oh, he's confused because he's in shock." No, it has nothing to do with an emotional state or your state of mind. This has to do with blood flow. When the blood flow to your body is not sufficient, that is a state of shock. And cardiogenic shock comes from the heart. The genic part means genesis. It starts with, it begins with the heart. So the heart is the reason why the blood flow is not adequate to the body. The most important cause of cardiogenic shock is a heart attack, where blood flow is cut off to the heart muscle, and then the muscle is unable to pump sufficiently to get the blood to your body. That is cardiogenic shock. Cardiogenic shock is treated in several ways. The first is simply to identify it. Almost always there will be low blood pressure, and the blood pressure may be so low that the patient will actually pass out. So EMS is called, an EMT or paramedic will arrive, assess the patient, and place an IV. Through that, IV fluids can be given. Often that's not actually enough, though, because it's the heart that is struggling, not just the fact that the patient doesn't have enough fluids. So the patient is transferred emergently to a facility where a cardiac catheterization can be performed. That's a procedure done by a cardiologist where a wire or small catheter is fed up through the arteries into the heart in order to look for a blockage. And if a blockage is identified and causing a heart attack, that will be opened. That improves the blood flow to the heart muscle and may help with the cardiogenic shock. Sometimes that's not quite enough, though. It's like the ball is already rolling and gathered enough steam that it can't be stopped. If that's the case, if the cardiogenic shock continues even after the blood vessel has been opened, then a hemodynamic support device is placed. That's a temporary device put in, usually through the groin, that will help the heart. It helps move the blood. It's a form of a mechanical pump. It's temporary, stays in for a day or several days. The brand name that's mostly used is called an Impella. So if an Impella is put in, that can help the heart by helping to move the blood to the body tissues. That can help to alleviate the shock and improve the blood flow. How can you avoid cardiogenic shock? Well, a heart attack is the most common cause, so it amounts to avoid having a heart attack. Well, how do you do that? You attend to the risk factors that have been identified. So, smoking, diet, exercise, cholesterol, genetics, and stress. Okay, smoking. Don't ever smoke again. If you're a smoker, stop right now. If you're not a smoker, then don't ever pick it up. That's the number one thing that smokers can do in terms of avoiding a heart attack and cardiogenic shock. Diet. Eat more fruits and vegetables, less fats and red meats. That can help, definitely, in terms of your risk of having a heart attack. Exercise. Exercise more. Take the stairs, not the elevator so much. Walk and attend to vigorous exercise 3 or 4 times a week. In terms of cholesterol, have it checked. Monitor it. Work with your physician with diet and perhaps even medications to help keep it under control. Genetics, you can't hardly help, of course. Choose your parents carefully, as they say, but be aware that that is one risk factor. And then stress. Try to avoid stress as much as you can in your work and family life, and that can also help. So with all of those things together, you can help yourself in terms of decreasing your risk for coronary artery disease and along with it, heart attack, and thereby help prevent you from suffering from cardiogenic shock. Hey guys, thanks for watching. I know you care about your heart. Thanks for subscribing. I know you have some questions, so leave them as a comment. I'll be sure to answer those. God bless you as you seek to live well, and I hope to see you in the next video.